So, welcome back to our channel once again. Today, I am actually going to discuss regarding the old topic only, that is the anatomy of the adenoids and tonsils, and based on some MCQs which were being asked already, or maybe some potential MCQs for your PG entrance examinations. Okay, so let us start with the topic. So firstly, to discuss regarding the point of this anatomy of physiology of tonsils and adenoids based on these MCQs, we will start the quiz now. The first question is, where are the palatine tonsils located? The question answers, the options are, first one is laterally in the oropharynx, secondly in the posterior superior part of the nasopharynx, thirdly at the base of the tongue, and fourth option is midline between the palatoglossal and palatopharyngeal arches. So what you need to know from this MCQ is that the palatine tonsils are the tonsils which are located laterally in the oropharynx in between the palatoglossal and the palatopharyngeal arches. So in these options there are two options, one stating that the palatine tonsils are located in the oropharynx laterally, so that is the first option. Secondly, then is another option which says it is in between the palatoglossal and palatopharyngeal arches. If you just by at a glance see the question and the options and conclude that the tonsils are in between palatoglossal and palatopharyngeal arches, so just go with this option. This will come out to be a wrong ones. So this is not the correct approach. Okay, you just see over here that this is saying that this is midline. Okay, no, the midline tonsils are not in midline. Okay, rather to say you palatine tonsils are not in midline, so this option comes out to be a wrong ones, whereas this is the first option is the correct ones. Correct. Whereas if you say in the posterior superior part of the nasopharynx, it is the nasopharyngeal tonsils, also known as the adenoids. Correct. Thirdly, at the base of the tongue, it is the lingual tonsils. Next. So this comes to the correct ones. Next. When does the adenoid typically starts atrophying? So I had said you in my previous video on this topic that adenoid is a tissue, tonsillar tissue present in the posterior superior part of the nasopharynx, actually in between the roof and the posterior pharyngeal wall, roof of the nasopharynx and the posterior nasopharyngeal wall. At the junction of those two, there is the adenoid tissue. And this adenoid tissue is actually present in every child, and it grows up to the age of 5 to 6 years. Then about 6 to 7 to 10 years of age, it is about a plateau phase, and then it starts atrophying at the time of puberty. So yes, it is actually starting atrophying at the time of puberty. So this is the correct answer to go with. Okay, next question. What is the mucosal covering of the palatine tonsils? I had said you that even the crypts of the palatine tonsils are lined by the non-keratinized epithelium. So this is the non-keratinized squamous epithelium, correct? So this comes to be the correct answer. Next option. Question. Which tonsil persists even after 8 years of age? Obviously by 10 to 12, even from, okay, adenoids are gradually atrophying, no problem, but the palatine tonsils are actually present even after 8 years of age, no doubt in that, and the lingual tonsils also may be present even after 8 years of age. So both the lingual tonsils as well as palatine tonsils are present even after 8 years of age. So that is the correct option to go with. Next question. What is the main function of the adenoids and lingual tonsils? Obviously, each and every tonsillar tissue or lymphoid tissue in the Werder's ring actually acts to strengthen our immunity. Okay, acts as a protective sentinel for host defenses. So obviously, the answer should go with creating immunity against pathogens. That is the correct option to go with. Next question. Which lymphoid tissues does not make up the inner ring of Werder? So we had actually discussed regarding this point that the Werder's ring is made up of two rings, the inner ring and the outer ring. So the inner ring is made up of, firstly, we should have gone with the fact that it is the adenoids at the posterior superior part of the nasopharynx. There are the tubal tonsils surrounding the tubal orifice, that is the torus tubarius, which is the cartilaginous part of the eustachian tube projecting out with the mucosal covering on it. So that is the tubal tonsils or Gerlach's tonsils. Then there is again, obviously, no doubt, the palatine tonsils bilaterally in the oropharynx. Then the lingual tonsils. Okay, along with them, we had also said that physiologically the inner Werder ring also connects to the lymphatic nodules on the posterior pharyngeal wall, as well as there are some lateral pharyngeal bands. So these are there in the inner Werder ring. So here, if you are being asked that what is not a part of this inner Werder ring, the answer should have gone with, obviously, submandibular glands. So lingual tonsils, palatine tonsils, adenoids as well as tubal tonsils, these are all the parts of the inner Werder ring except the submandibular gland in the option. Okay, so this comes to be the correct answer. Next question. What does Plica semicircularis and Plica triangularis do? What are they? I had said you in the video, in the previous video, that there are there are one anterior pillar of the palatoglossal arch and one posterior pillar of the palatopharyngeal arch. There is the tonsil sitting in between them two, palatine tonsil sitting in between them two, supported anteriorly by the anterior pillar, posteriorly by the posterior pillar. But from now there was something very much important over there, which is actually connecting the anterior pillar to the lower pole of the tonsil, that is up to the posterior posterior pillar. Okay, and this very membrane mucosal covering is actually from anterior to posterior, and secondly one another is there which is coming like this to the, and from the anterior pillar to the posterior pillar, but that is actually going like this. That means it is going up to the posterior pillar across the superior pool of the tonsil, and this very membrane is known as plica triangularis, which is posteriorly, and this is known as plica semilunaris, which is anteriorly. Importantly, these two actually prevent the tonsils to go down, or rather prevents the tonsils to fall off within the throat, within the oropharynx, correct? So just strengthen the tonsil with the surrounding structures, correct? So the answer goes with the D. Okay, that comes to the correct answer. Next, which artery is the most important blood supply to the tonsil? This is a straight cut forward question. Tonsillar artery, no doubt in that. This is tonsillar artery. Next, how are the palatine tonsils, adenoids, and the lingual tonsils are differentiated based on their locations? I have already discussed this point. So obviously, palatine tonsils are located in the throat, adenoids in mouth, lingual tonsils in tongue. This is a very much vague concept, so obviously this comes to be wrong. Secondly, they all have same locations but different functions. Again, wrong. Okay, this is none of the above, gone away. This one obviously correct. So what is it? It is located in the oropharynx, palatine tonsils. Adenoids in the posterior superior part of the nasopharynx, and lingual tonsils in the base of the tongue. Lingual tonsils in the base of the tongue, correct? So obviously this comes to be the correct option. So C is the correct one. Next, how are the tonsils supported anteriorly and posteriorly? I have already said it. It is anterior and the posterior pillars. Next question, where do the tonsillar arteries originate from? You know very well than me. What should be the answer going with? Obviously external carotid artery. Okay. Next, which statement is true about the adenoids? They have multiple crypts. Crypts are there in the palatine tonsils as well as in the lingual tonsils, but not in adenoids. Adenoids have furrows, so obviously this is a wrong option. Grows maximum until 15 years of age. Is it 15? No, not at all. Located in the lateral wall of pharynx. Obviously that is the palatine tonsils. Again, wrong. Atrophy starts at puberty. I have already discussed this point. Obviously correct. Next, what is the main function of tonsils and adenoids and protective sentinels? Host defenses, correct? So I have already discussed in the previous video that the adenoids and tonsils act as protective sentinels for host defenses, correct? Next, what is the primary lymphatic drainage of the palatine tonsils? I have mentioned the point that the primary lymphatic drainage of the palatine tonsils are the jugulodigastric nodes, which are enlarged and tender in a case of chronic tonsillitis, and which is shown, the sign is known as, the sign is known as Wood's sign, correct? So that is jugulodigastric nodes. Next, tonsillar bed is formed by all except, there is a except in the question. So styloglossus muscle, yes, obviously styloglossus is there. Secondly, superior constrictor muscle, no doubt in that. Buccopharyngeal fascia, again no doubt in that. Stylopharyngeus muscle, yes, it is not there. It is the palatopharyngeus muscle, not stylopharyngeus, correct? So obviously I should have emphasized on the point of tonsillar bed now. Okay, so let me go to this slide. Okay, Obviously that should be the answer, stylopharyngeus. Okay, so now you see there is the tonsil being drawn, and this tonsil is actually having a covering, that is the capsule. So this very capsule is nothing but the condensed pharyngobacillar fascia. Okay, so this is pharyngobacillar fascia, in short form PBF, and there is also the posterior pillar, that is the palatopharyngeus muscle. Okay, palatopharyngeus muscle. Then there is the, then what is there? You know very well than me. There is the muscle layer, and that is the superior constrictor. Okay, superior constrictor. Okay, and then the point of I want another fascia, that is the buccopharyngeal fascia, BPF. Then comes the styloid process. I had said you there was the styloglossus muscle. Okay, so and in between here there is the internal carotid artery, external carotid artery, branching through the tonsillar artery, supplying the tonsil from lower pole, like that. Correct? So that is the answer. It is stylopharyngeus is the answer to go with. It is actually the palatopharyngeus muscle which is in the tonsillar bed, not the stylopharyngeus muscle. Option number D. Next, which does not supply the adenoids? So you should be understanding that yes, the ascending pharyngeal artery does supply the adenoids. Correct? Okay. Secondly, adenoids are also being supplied by the ascending palatine branch of the facial artery, and the inferior thyroid artery also supplies, but the superior thyroid artery does not supply the adenoids. So that is the correct answer to go with. Okay. Next. Now we have actually reached the end of this MCQ session with some true or false questions to go with. Correct? So starting it. Okay, so the first question is, tonsils act as protective sentinels against harmful intruders. Obviously this is a correct answer to go with. Next one, lingual tonsils have a non-keratinized epithelium lining. Yes, so again this is a correct option to go with. Adenoids have multiple crypts on their medial surface. I have said you that adenoids have furrows, not crypts. So this is a wrong answer to go with. And Wood's sign is seen in chronic tonsillitis. Yes, it is true. Correct? So that is the answer being given over there. Take it. Next. Adenoids have furrows on their surface. I have said you, yes, this is true. The tonsils differ from lymph nodes in not having a subcapsular lymphatic space. Yes, this is true. Next, tonsillar capsule is condensed buccopharyngeal fascia. I had actually mentioned it wrong in the video. That's why, to emphasize on the point that the tonsillar capsule is actually condensed pharyngobacillar fascia. It is condensed pharyngobacillar fascia. Okay, then the condensed buccopharyngeal fascia. So that's why obviously this is a wrong point. That's why I have actually selected this question. Okay, to just emphasize on that point that yes, in that video I had given a correction note for this very point. Okay, lastly, nerve supply of the tonsils are derived from the sphenopalatine ganglion. Yes, obviously it is true. Correct? So that is the point to discuss. So thank you very much for patient hearing. Today we have actually emphasized on the point of the anatomy of adenoids and tonsils, the basic important points from my previous video on the total topic of this anatomy of adenoids and tonsils, based with some multiple choice questions and some true false questions, to just make a imprint on your mind about the perspective of questions being asked from the topic. Correct? So thank you very much for your kind listening. We will furthermore describe about the further parts of the adenotonsillar diseases, with some acute conditions, some chronic conditions, with their management, including tonsillectomy, in our upcoming videos. Thank you very much for patient listening.